Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, state-required immunization changes, opioid guidelines, important healthcare topics, but first, what else? The Pennsylvania budget. The debate continues.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Well, welcome back. Hope you had a great New Year. I think for the politicians in this state, it might not be the best of years. Joining me to talk about that and something else that we've not talked about on this show, something I'm just learning more about called ride sharing. It may not be what you think, but joining me is Josh Novotney. He's the Vice President for Governmental Affairs at Triad Strategies, and Brittany Crampsie, used to be Brittany Foster when she was on the program before. She's the Associate of Triad Strategies. She used to be with a great website. Get on it, Politics PA. All right, Josh, let me start with you. Here we go. Governor Wolf line item vetoes the $30.2 billion budget. We have basically a stopgap. He vetoed $11.2 billion. You notice I'm reading this to get it right. The fact of the matter is that he provided emergency funding for a variety of programs for the next couple of months, but they've reached no big decision on taxes moving forward. Where does all this go?
Yeah, that's a good point, Terry. I mean, that's where the big decision still has to lie here. It's education funding and how to pay for everything, the tax code, meaningful pension reform, and none of those decisions were made this week. So I think we go into January and month 7 on the debate.
Yeah, and so the governor, Brittany, the first Tuesday in February is a big event in Harrisburg, isn't it?
Correct. I mean, we're going to have the budget address for the next budget before we really have this one completed. So yesterday, his press conference, yesterday being Tuesday, his press conference, he laid out what he was going to do. So he's allowed emergency funding to go to schools and to human services programs. So the schools that we're going to have to close after Christmas break are going to be able to stay open, and people who need human services are going to get them. But like Josh said, there's still a lot to be done. And what I think was really good about the governor's remarks is that he's negotiating in good faith. He had the option to blue line legislative spending and then force them back to the table immediately to restore funding so they can operate at all. But he didn't do that. He kept them at the levels that they were at the previous year, and now they can come back and all negotiate in good faith on things like a school funding formula, any continuing revenue package, and then the level of education funding that the governor asked for last March when he gave his remarks.
Now, Josh, the Senate Republicans and the governor reached a deal called the framework. $30.8 billion. There would be pension reform, a 2-tier pension system for people in the 2 big pension systems, state employees and school district people, in effect, resolved. Over in the House, where there's just not a consensus, and I don't see that changing. You know, you've got all these lawmakers in the House who are elected with mandates, with 60% of the vote, 110 of them no opponents. I mean, you've covered this stuff for a while. Sure. Is there any way out of this morass?
Yeah, I think the House, they were concerned that the framework on the pension reform was not concrete enough, that they were painting themselves into a corner on having to raise taxes. So I think maybe a way out of this is working on pension reform first. If the governor will compromise with either the House or the Senate on it, and they can kind of move forward from there, knowing how they'll get paid for.
Doesn't it all come, I mean, knowing how to pay for it. The governor would like a shale tax. We all know what's going on with the price of natural gas. It's dropped. A 5% shale tax wouldn't give you the $700 or $800 million that they talked about before, maybe down in the $5 million range. And the state still has this structural deficit. And with no new revenues, how does that get resolved? I mean,
that was one of the governor's issues in his remarks. He said that this wasn't a balanced budget, that they sent him a piece of garbage that had a shortfall this year and an even bigger shortfall next year. So without any continuing revenue package passed this year, everything is again on the table in February when he comes back. There have been discussions about an expansion in the sales tax, which could include other professional services that aren't currently taxed now. There could be an increase in the personal income tax. A shale tax is on the table. I mean, there are a bunch of different options to get to the revenue that we need. But then, like you said, there's other pieces that are also on the table: pension reform, liquor privatization. There are a lot of moving pieces to this, and we're going into another budget cycle now where we could discuss them again.
It's like, here we go again. All right, when we come back, we're going to run to a quick break. Something that I don't think, I didn't certainly know much about. We got some experts who are going to help us out. Ride sharing, it's called TNC. What's that all about? We'll take that up in a moment.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania State Education Association and Partners for Public Education, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Welcome back. Well, there's something called TNC, and they're going to help me out with this, and ride sharing. Brittany, let me start with you on this. Are there state regulations? Used to go, if you go, you get a taxi cab, it's licensed, it's regulated, but there's other ways to get rides now that aren't so regulated, Lyft and Uber. What's that all about?
Well, there are easier ways to get rides now. TNC stands for Transportation Network Company, and these are the ride-sharing companies. People will probably be more familiar with the names Uber and Lyft. Those are the two companies.
Uber and Lyft. I know the names.
So to be an Uber or a Lyft driver, you go through a rigorous screening process with background checks, and then you become approved to use this app. So when you sign on to the app, you find other people in your area that are looking for rides.
Who's doing the checks?
The companies themselves.
The companies do the checks.
They approve their drivers, yes.
Are we talking about having, Josh, let me go to you quickly. Are we talking about regulations, state regulating Uber and Lyft, other companies like that? Is that what this is about?
Yeah, that's what this is about. The Senate passed a bill in November that would add background checks, mandatory for the state, wouldn't allow violent criminals to drive for these companies. I think certain levels of car insurance had to be obtained, things like that. But the companies, as Brittany said, are doing a lot of this themselves because they don't want incidents with their drivers and customers. They want to have a good, prosperous business.
Would when Josh says there'll be background checks, would the company still do it under these state regulations, or would the state do them, or would they have to report to the state what they've done?
Well, this isn't quite finalized yet. Right now, Lyft and Uber are operating under temporary approval from the PUC. They're working on statewide legislation now that would enable them to exist forever. And that would iron out things like who has to carry the insurance and what level of insurance they have to have, and then what kind of background checks, who pays for the background checks, and how expansive those have to be. So these are things that will hopefully be ironed out next year because there's a major event happening in Pennsylvania. The Democratic National Convention.
Oh, a little something like that
is
down
going
in
to
Philly?
be in Philadelphia. So you're going to have thousands of people coming into this city without their own personal cars. And if the taxi system can't handle it would be wonderful to have something like Lyft and Uber ready.
Well, how ubiquitous in the state? Maybe it's a question you don't know. I don't know. I don't ride in taxis except when I go into a big city and I'm in a hotel and come out of a hotel. You get it. I mean, is it expanded greatly in our state?
Yeah, especially the major cities. So I live in Philadelphia, and UberX, I think, had 700,000 rides this year. And to add on to what Brittany was saying,
that's pretty big.
Exactly. So, but to add on to it, there's a two-part issue here. The Utility Commission has granted a temporary approval for 66 counties, but the 67th county is Philadelphia, where the Philadelphia Parking Authority monitors the limos and the taxis, and they hand out medallions that taxi drivers pay for. So there's a little bit of an extra layer of complication there.
I got it. Now, you live in central Pennsylvania, as I do.
Yes.
Are they here? Do we have any here?
They're here as well, of course, in lesser quantities than they are in Philadelphia.
I would think
so. If you want to find an Uber or a Lyft in central Pennsylvania, it's not impossible.
Well, how do you find them?
You download the phone app and you say where you are and where you want to go.
You get on,
and it shows you little cars driving around in your area, and you can get matched up that quickly.
That is weird. All right, thanks for coming on the program. All right, coming up, important topics: changes to state-required immunization. What we're going to opioid guidelines every day. You read about some problem with opioid abuse. We'll take care of that and more after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania, and by the Pennsylvania Coal Alliance, representing companies involved in America's most affordable, reliable energy source. To learn more, visit pacoalalliance.com.
Well, we're going to turn to a number of important healthcare subjects. These all have been in the news lately. They're very important. We're going to provide a timely update on them. Joining me, as often is the case, is Dr. Charles Cutler. He's the president-elect of Pennsylvania Medical Society. Welcome, Dr. Cutler. Sitting across from me is Gary Tennis. He's the secretary of the Department of Drug and Alcohol Abuse, and the physician general of the state, Dr. Rachael Levine. A lot of titles, and you're not even college professors. I want to start with you about changes to the immunization laws. And I've been reading a little bit about them. What is important? What should the viewers know? What should folks know, particularly those with kids, and what they should do? What do you want to change?
Sure. So immunizations are actually one of the success stories of modern medicine. They provide protection against many infectious diseases such as polio, not only for the patient, but it also provides what is called herd immunity. Now, it's a rather unfortunate term because we're the herd.
But it means a group of people, right?
That's right. So that if there's enough individuals in a population that's immunized, it's unlikely that you'll have any type of outbreak.
Yeah.
Now, this was a big issue this year because of the outbreak of measles in California and the West Coast. Measles is a very significant and potentially very dangerous childhood illness that we don't see much anymore because of our immunization. Yeah. So we took the opportunity to look at our immunization rates as we entered office in January and February. And what we noted is that our immunization rates for kindergarten students to have 2 of the measles vaccines was not where it should be. In 2014, 91% of children had 2 of the measles vaccines, and you need 95% to have herd immunity.
To be effective.
That's exactly right. So when we looked at the data, the main issue was an 8-month provisional period from the time that children could enter kindergarten to the time that those immunizations had to be up to date. So what we were doing is we've worked very closely with the Department of Education on regulation change to take away that 8-month provisional period and reduce it actually to 5 days.
5, right. Now, look, I'm looking here at the list. I mean, required for start of attendance. Doctor, I mean, it goes on and on. You don't quite realize the scope of this, correct? I mean, you got diphtheria, tetanus, am I right about
this?
That's right. You are polio, correct. Measles. The doctor just talked about that. Mumps? Go ahead, take it from there.
Terry, this is either a glass half filled or half empty, but seeing it half filled, I look at all of these diseases that we can prevent. So this is actually great news. If you go back a generation or two, most of these diseases on your list were uniformly fatal.
Wow.
And here we have progressed to the point where we can prevent so many illnesses and allow people to live longer and productive lives.
People in my generation, I had measles, I had mumps, right?
That's right.
I had all of these things,
but
correct?
They're potentially very serious infections. We just don't remember that because of the protections offered by the immunizations. Now, immunization policy is very closely monitored by the Center for Disease Control and other organizations such as the American Academy of Pediatrics. So all those vaccines are very safe and very effective.
And what we're doing here is you're requiring them to get into school, and then at a kind of an intermediary period, 7th grade, right?
There are more boosters in 7th grade as well. So usually the boosters are given when children enter a larger arena.
How do people know what they're supposed to do? Is that a dumb question?
You have to rely on your doctor. And this is.
How about if you don't have
we all need primary care doctors, whether you're just a few months old.
Do we need more in the state?
We do. Yes.
Yeah. All right. Where do these changes stand?
So these changes stand in terms of regulation change. So we're hoping that will be accomplished before the school year in the fall, and that will be accompanied by a very intensive media campaign called Don't Wait, Vaccinate, where we want children to go see their pediatricians or family physicians, their primary care doctors, as you mentioned, in the spring and in the summer to get their immunizations before they start school to protect our school children.
All right, we're going to run to a break. When we come back, we're going to broaden the discussion. We'll bring Gary Tennis into this. We're going to talk about opioids. Every day, almost every day, Gary, I read something about this.
Yeah, every day
right
in Pennsylvania,
or wrong?
we're losing at least 7 Pennsylvanians dying every day from drug overdoses.
All right, there you have it. When we come back, what can be done about it? We'll try to provide some help, assistance, aid. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine. And by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Business Council and by the Pennsylvania Business Council Education Foundation.
All right, one correction. The host made a mistake. It's the Department of Drug and Alcohol Programs, not Abuse. Mr. Tennis is over there looking at me, wondering, get it all straight. You wanted to make a quick point.
Yeah, just a fact about the vaccines. First of all, they are safe. And a number of the childhood vaccines have actually been accused in some media reports as causing illness, causing autism. There simply is no data to support that. All of these childhood vaccines are safe. And this is flu season now. And we will soon, January and February, we will soon see significant outbreaks of influenza. And now is the time, if citizens haven't had their flu vaccine, they should get the flu vaccine. And the flu vaccine does not cause the flu.
Good point.
It is impossible.
Good point.
It is a safe vaccine, and it will protect Pennsylvanians.
Thank you. All right, let's go to opioid prescribing guidelines. Healthcare providers. Best practices. That's basically what we're talking about, right?
That's
Healthcare
right.
providers give out, prescribe the drugs, right?
They do. Well, there was a sort of a sea change in the medical community, and where opioid prescribing was dramatically increased. There were a lot of claims made that the risk of addiction was exaggerated or overstated, and one of the measures of good health care was elimination of pain, and opioids were the go-to drug. Opioid prescribing quadrupled, and in that time, as a result of that, and as a result of the fact that we so severely underfund treatment and prevention in this area. It leaves us vulnerable. With that shift in prescribing, we had enormous number of Americans getting addicted first to prescription opioids and then to heroin. When addiction left untreated is a progressive disease, so a person might set a line and say, well, okay, I'm hooked on Oxycontin, but I'll never put a needle in my arm with heroin.
And so they think there's no problem, right?
Well, they think they can. Everybody thinks they can handle it. One thing that you find with addiction, if it's left untreated, is that the individual will set lines that they'll never cross. I will never do that, but ultimately they do, because one's life falls apart. You end up losing your job, you end up losing your family. Your brain wiring shifts so that all of the reward pathways go to the drug instead of to all of the wonderful things about life that reward us. So.
And we all know someone. Here's what's fascinating. You can't go anywhere and not find, and you're a physician, we can't go anywhere without finding someone with their own family, direct or extended, that doesn't have this problem. It's
the scope of this epidemic has changed significantly since the 70s. So it really, as you said, hits every household. It's not only urban, but it's suburban and rural. It's all demographic groups, and it is really the most serious public health crisis that we have right now: opioids and the risk of overdoses.
From the medical, go ahead. No.
Yeah, so one of the greatest challenges for me as a primary care doctor is knowing which new patient is doctor shopping, is in my office simply looking for narcotics, and separating that patient from the patient who has legitimate pain and need for an opioid prescription. And thankfully, now the Pennsylvania legislature has passed new legislation that will create a data bank, a database that I, as a primary care doctor, will be able to access to tell if the patient across from me has been to another doctor earlier in the week.
Drug shopping. That's a new, doctor shopping for drug to get
but it goes on all of the time. It's a very small number of people, and we certainly don't want to stigmatize patients who have legitimate pain and need for opioids. But we just need, as a primary care doctor, I know I need the ability to find out who got a prescription for an opioid earlier in the week. That patient, obviously, the red flags go up if he or she is in my office now looking for a new prescription.
What are some of the guidelines? Give us a hint of a couple that you think are important.
One of the guidelines is just to go back to what Dr. Cutler was talking about. When a doctor identifies somebody as engaging in drug-seeking behavior because of a substance use disorder, it's absolutely critical that that doctor not just throw the patient out to the street. We need our doctors to speak with the patient about it, to get that individual assessed and referred into substance use disorder treatment, into drug and alcohol treatment. Absolutely critical, because if they throw them to the street, ultimately that individual is at great risk of shifting to heroin and dying. It could be a death sentence for that person. So
you get some of these, again, everybody has this in their family in one way. This destroys people's lives. We're not talking about...
Yes.
Go ahead. Finish the thought.
It's a lot of people's lives. You and I grew up during the Vietnam War, and we remember the coffins coming home and the shattered families, 50,000 Americans. That's how many are dying every year from this. That was a 12-year war. We're talking about every single year. So we have shattered families. And when it's a death, it's not just a statistic. It's a family that might have loved their child, that had high hopes, that put their life, their heart and soul into it, and now their child's gone. So the risks are so great. We're really, in the Wolf administration, we are working kind of firing on all pistons. Dr. Levine has signed a standing order for naloxone for every family.
All right, well, here's what we're going to do. You're all going to come back when you get through this, implement it more. We'll be back. We'll see you next week for another edition of Pennsylvania Newsmakers. And as always, stay well.